With regard to the Catholic Community Connection, I see it as playing an exceedingly important role in trying to help us meet the needs of all of our patients. The program, as well as the hospital, serve a lot of people who are underserved, particularly in the surrounding community, and these are people who have enormous medical, spiritual, psychological, you name it, needs of all types. We have a lot of people who live in homes that are less than ideal. We have people who are homeless that we care for. We have people who generally neglect their care because they either do not have the inclination or do not have the money, do not have the resources to obtain the kind of care that middle class and upper class America generally experience. So the needs that we have go beyond diagnosing what the problems are, prescribing medication, and get down to the nitty-gritties of, can you afford to get here? Can you cope with the complex transportation system to get to your doctor, be it at the St. Luke's office or at the ambulatory care center down here, let alone the emergency room here? Having been able to get here and having gotten your prescriptions, can you afford to pay for those? Can you deal with the issues in your living situation that are problematic? If you are somewhat older, if you have different types of disabilities, there are major problems with that. What I notice most in terms of the needs of our people are for support systems and social services that try to deal with the many problems that I've just very quickly covered. But it is exceedingly frustrating for the caregivers, both those who care for people only in the hospital and those who care for them in our ambulatory sites, to be able to provide only partial care and not to really be able to address the many social and economic, cultural needs of the population. And we look to the Catholic Community Connection to try and begin to help us with all of these needs, provide us with a smooth kind of system in doing this.